how does this question of
Yeah,
health
where?
inequities, where does food addiction fit with
Yeah, we've
that?
really been looking at this in the context of food insecurity. So we published a paper. We actually have like two or three more in the pipeline. With one of my doctoral students, Lindsay Parnarowskis, has really taken the lead on this. And she's done qualitative work, quantitative work. We've collaborated with people all over the US. We're seeing that people who have food insecurity are really at heightened risk for food addiction, for this highly processed food addiction. Sometimes up to our current estimates are anywhere from 50 to 80% at higher risk than those who are not food insecure. And we know that individuals from stigmatized minority populations are more likely to be food insecure due to many of the structural obstacles in our society. And when we think about when we looked at this mechanistically, to me, it's really a social justice issue. It's why I've had people be like, oh, well, we all have to eat, so this can't be addictive. I'm like, no, we all have to eat. So it's a huge concern that, like, for the
Who has
average
access
American,
to
yeah,
what
we
types of
have to
foods?
engage with an environment where the majority of calories are highly processed. And if you're poor, it's even more. That's almost the only thing you have convenient, affordable access to. And so, from a social justice perspective, I think this is huge, especially we have so many people in my lab who had food insecurity as a child and then are now food secure. But the experience of having food insecurity, a critical time in development, not only increased their risk factor for highly processed food addiction, but also other substance addictions. These are things that we can address in policy ways to, again, have this trans diagnostic benefit to address some inequities by making sure that everybody can have affordable, convenient access to nourishing food. But if we say, oh, there is no difference between an apple and apple pie, hot apple pie from McDonald's, they're all food, there's no difference between them. I do see that as an obstacle between us being able to address some of these health nutrition equity issues.